Okay, so final session of the afternoon before we break for some networking. So my name is Nick Flude. I'm the Chief Marketing Officer of Sekuro, and in conjunction with Charmaine, we have created this kind of afternoon for you. So I thank you for your attendance, and I thank you for sticking with it. I'm now going to take you on to just the last presentation. It's a theme that has been very present through the day, and that's about the most precious asset that we have within our organizations, which is our people. October is both Cybersecurity Awareness and Mental Health Month. So not just because of that, it's because of a conversation that we started to have at the start of this calendar year. We started to try to get some data behind the impact of mental health on the cybersecurity industry. So one of the challenges that we have as a new startup is that nobody knows our name, and we are hiring for exactly the same amount of people than everybody else is. And that's really, really difficult when we're trying to encourage people to join our organization, as well as then retaining the people that we do have. So mental health, and obviously it's been a pretty rubbish kind of 2 years. So essentially kind of why did we do it? Why do we do it now? 2 years have been kind of relatively kind of hard for people. There's definitely been impacts that we've found across all levels, and we kind of had a sense of the impact of mental health within our organization, but the data came back and we were just blown away by just the widespread impact of mental health on our people, basically. So some of the key findings. So 9 out of 10, so I'll say that again, 9 out of 10 people in our industry have been impacted by mental health issues over the last 2 years. And as you heard from kind of Shane and Brett, it is always that ongoing challenge that you have to keep yourself mentally fit and strong, to then take the best of what you do to your job. So that's critical. So that's 9 out of 10. And we didn't plant the questions, but Shane and Brett also spoke about the leadership impact. So as leaders, as senior people within the cybersecurity industry, the decisions that you make, the pressure that you put on your team cast a big shadow. And by that I mean the decisions and the way that you carry on with yourself spread down across your organization. So as leaders, we need to recognize that, and we need to be mindful of that. Now, at a time when we are globally trying to attract people into our industry, and in Australia, depending on which survey you read, there's a shortage of 130,000 to 300,000 jobs within our industry. So it was really disheartening to kind of read the statistics there, that almost 37% of our respondees, and this was a survey, we got to just over 100 respondees, 37% of those quit our industry. So just think about that. 9 out of 10 people have been impacted, and 37% of our staff are leaving because of the challenges and what us as management are doing to the organization. So some key slides, only for 10 minutes. There's a universality, I can't even say it, you read it. It's that, it's everywhere, that's what it means. So on the right-hand side, ranging from department lead. So this is 81%. We're not talking about, 30% of people and 25 or 10%. At worst case, your department leads, 8 out of 10 of them reported mental health challenges, all the way up to 100% at the individual contributor level. So just think about kind of the way that your team is operating and the stresses that they are under. And then when we actually ask them, well, do you know, are you talking about this within your organization? Do you recognize that this is something that your colleague, and we just had Are You OK Day? So just asking them. So 38 to 42% said, yes, 1 to 3, or even greater than that, so more than 4. So this is something that is impacting all employees regardless of their job title, and the majority of teams across our organization. So then when we kind of try to dig into that, well, why, what's causing this? Is it just the never-ending rise of ransomware and all of the attacks and all the doom and gloom? And again, surprised by the answers to then say, actually, no, it's internal pressure. And we heard about presenting to the board, we heard about management, we heard about the breach notifications and all those kind of things from the earlier session. So the pressure is coming from leaders and the pressure is coming from the board, you know, unrealistic expectations. This was done, I'm going to say, pre the very public breaches of the last few weeks. This closed off in August. So we didn't have that added pressure and the added visibility of those very, very high profile breaches that added to this. So it's very much about internal pressure before they started to worry about what was happening externally. And, you know, why did we do a board session? To give you that chance to pitch. Unrealistic expectations from the board. So training your board and training your leaders on the things that are critical within the cybersecurity industry is crucial, and that has a direct impact on the mental health of your team. Lack of action. Talking about it, raising it within your organizations, but then there is an expectation that something happens. So the question, if you have experienced mental health issues, what actions did you take? So 44% went to their management. They did the right thing. They reached out. But only 24% of them said that those concerns were addressed. 37% again, they quit their job. They left an industry that is crying out for clever people. And we are trying to attract and retain grads at the same rate. Interestingly, it's not about the money. So only 15% there are saying, you know, a pay rise would help me and my mental health challenges. So again, just think about the data and think about the things that you can do. So what helps people get a positive mental health outlook? Getting outside, staying active, spending time with family and friends, but also then setting clear boundaries at work or between work. So having that flexibility. So physical health very much has a positive contribution to mental health. So what's Sekuro doing kind of this October? We're talking about it. So we're raising the level of awareness about cybersecurity and mental health. I'm going to show you 2 QR codes, and I know security people don't like taking pictures of QR codes. I understand why. So what are we doing? 1, we've done the survey. The QR code will take you to Sekuro.io, and it will take you to the mental health research findings. So we have a full paper that I would encourage you to download and to read and to share. It's free. Recognize the problem, do something about it. What are we doing as an employer? We're encouraging people to be physically active. We're encouraging walking and talking meetings. One of the things that did come through is that there is a healthy amount of imposter syndrome within the cybersecurity industry. You don't have to sit the bar exam to become a CISO. So there's very much around mentor walks and talks. And there are a number of organizations out there that will get mentors together to talk and just get some physical activity. So walking meetings, team activities. So Sekuro, we are lucky to have a very, very good people and culture team. And they do lots of things that get us together to allow us to be a team and also then be physically active. Recognizing and supporting mindfulness, so being present, understanding that there are pressures and understanding what you need to do to divest yourself of those, and then also quality time away from work. Now we have joined forces with one of our partners, Zscaler, and we are raising funds for Lifeline from the Lifeline Northern Beaches branch. We are doing a team-based activity where you can donate, and it's about essentially a team-based step count. So if the technology gods have been kind to us, then David Thomas, who is the CEO of Lifeline Northern Beaches, is going to be on a Zoom to talk to us about the work that Lifeline are doing in tackling kind of mental health. And there he is, he's on my left. David, over to you.
Thanks very much, Nick, and thanks everyone for having me this afternoon. One thing you didn't tell me, Nick, was that I was the follow-on after the Lee brothers, being Australia's, I think, worst ever cricketer, but greatest ever spectator. Well, that is a classic, so thank you for that. Anyway, welcome everyone, and look, thanks very much for, and I should thank everyone in advance for choosing Lifeline Northern Beaches as a charity recipient for your fundraising. We've had it pretty tough over the last year. About this time last year, we were just coming out of the Sydney lockdown, and you know, that went on for about 3 or so months, and we make most of our money, well, to fund the operations from our retail, and you might have seen our book fairs. So all of a sudden, you know, I had to fund and manage a cash flow with an increasing demand, and you can imagine during COVID for both counselling, telephone counselling, and text, that what we did with basically no revenue coming through from our shops or our book fairs. So fundraising initiatives such as this is very, very well appreciated, everyone, and thank you very much, because we just had our AGM the other night, and I had to announce probably the greatest loss in our history, so couldn't come at a better time. Just to give you a bit of an idea of what we do, Lifeline, it's been around since about 1963. Lifeline Northern Beaches was established in 1964. There was about 50 Lifeline centres around the country. There's now probably only about 38. Lifeline Northern Beaches would probably be, in terms of the calls, probably about the 5th ranking centre in Australia. In terms of people working with us, I've got a workforce of about 800 people, and that consists of people on the calls, people on the text, counsellors, book fairs, retail teams, so on and so forth. So it's quite a massive operation. But just to give you an idea of what we do at Lifeline Northern Beaches, we're probably one of the biggest, think of it as a franchise, probably one of the biggest centres in the country. The other big ones are in Sydney, but we'd have to be one of the biggest in terms of what we do in terms of service. We employ about 250 phone counsellors, answer about 70,000 phone calls a year. And we operate a text service. There's not many centres that operate a text service. And last year, we answered around about 56,000 texts, which is a new service. We found that the phones were a bit of a limited trajectory, and you know, with the younger demographic coming through, and they only like to use the phones, we had to get into texting. So that's a new service we have. Not a lot of people know that we do it, but it's good to know that it's there. So we do that. Well, one of our big claims to fame, and something I'm very proud of, is that we've built the counselling session practice up. Now, counselling, prior to my involvement, it was very difficult to get into. It still is. Like, if you've got to go and see a private counsellor, it'll probably take you about 4 to 6 weeks to book one in. And you can find it to be up to about $300 a session. It's not something you go to once. It could go ongoing for about 10, 20, 30 sessions. So the cost really adds up, particularly for a young family. We've come in, we've developed a practice, and we're now proud to say that we can see someone who needs counselling within about 4 or 5 days for only about $20 or $30. So it really does provide a need, or fills a need, that fills a gap that is not covered before we were there. So we now do about over 2,000 sessions of that a year, which is fantastic. And that really helps to bring what I see the tragedy rate in the Northern Beaches alone down. Before we put our programs in, and this is a bit of a sobering statistic, but we bought, and I won't give the actual numbers, but I can say that we brought the local statistics down by 30 to 40% in 1 year. And now when we talk about that and the programs and what we do, a lot of people say, Lifeline with a vision of Australia free of suicide, it's unrealistic, but I can see that just in such a short time, when you put the right programs in, you can really make a difference. So just to come back to where your efforts are going, those sort of fundraising will come to fund our efforts on the phones, on the text, and also largely the counselling, and also our support groups. So it's very important for you to know where they go. There's a bit of a takeaway for you. One of our phone calls, support calls, costs about $40, and one of our counselling sessions will cost about $150. So think of that at the end of the day, and that's where your money will be going, to helping those in need who wouldn't otherwise be able to get it, who wouldn't otherwise be able to access it. So on that note, I'll say thank you very much, and I can walk away now and say I have followed on from the Lee brothers, which I'll be dining out on that for quite a while. So thanks very much.
Great. So thank you very much to David. So again, it's a critical service that does cost money, and we're helping them. So what can you do? You, with your staff, you can encourage walk and talks. It's an easy thing. If Sydney ever gets back to nice weather, it's a wonderful thing as well. So take your meetings outdoors, get some physical kind of activity. Tackle the reality and the impact of imposter syndrome. There are many, many, many clever people who feel fearful when they get into an industry activity like this because they start to doubt themselves. Recognise the talent that your team has and reinforce that. Donate to the Cyber Walk for Mental Health via their website on this QR code. So we're just about to kind of get this up and running with the team from Zscaler. The donation site goes straight into Lifeline Northern Beaches, and as David said, that is critical. You don't see Sekuro branded merch in front of you. The reason for that is we are taking all of the money that we would have spent on branded items, and we're giving that as a donation on your behalf directly to Lifeline Northern Beaches. And the more that you see us at industry events and trade shows, the more you will see us donating to charity and encouraging everybody to kind of think a little bit more about reuse and recycle. Thank you. If you can do it, start your own charity challenge. There are so many, it could be mindfulness, it could be disability, of whatever it is, but use the power that you have within your community to kind of do good. And as leaders, as I've said before, just be mindful of the shadow that you cast. If you're having a bad day and you bottle it up, but your team can see that you're struggling, be human, be emotional kind of where it counts, because that encourages everybody kind of downstream on your, to do that. I would like to close off today's kind of afternoon. You will see sneakily that I've changed the year to 2023. We will do this next year. Charmaine and I will have less hair. Charmaine will look as beautiful and ageless as ever, but I will look